But the healthcare problem is not going to go away because the doctors keep getting better. Now, I mean that as a compliment to medicine. The better the doctors get, the more times they save you. The longer you live, the more cost per patient. Insurance companies can't keep up. So even if we're all fair and no one's overbilling and no one's overcharging and no one's getting you crutches that you don't really need because you came to their office and they want to make you feel like you did something, pardon me, the cost per patient will continue to go up because the doctors keep saving you. Isn't that great? It's great, but it's terrible. Like so many things, you get these dilemmas, you get these vicious cycles. What are we going to do? I don't even want to touch that question. What are we going to do? I'll tell you something though. Don't be fooled. Don't think, oh, Britain's got this great healthcare system. Britain, if you get brain cancer in Britain, they give you aspirin and say thanks. No, I'm not kidding. I'm not kidding. So you want a knee operation in Canada? 8 years. But on the other side of the coin, my dad just got double ankle replacements and he's 80. What is he going to play soccer next week? I mean, what are we doing? You know, who's paying for that and why? I mean, I know it's harsh, but are we really as individuals ready to start making the sacrifices? I don't need a new knee. Let someone else get those monies. I don't need that operation as bad as that person does. We're not ready to make those decisions in this country. We're not even close. So the healthcare system, what's the problem with the healthcare system? Well, we're all going to waste our time pointing fingers. The doctors, and I have a brother who's a doctor, by the way, and a brother's a lawyer. So I've seen this problem. Everyone yells at everyone. The doctors blame the lawyers blame the doctors and the insurance company. The insurance company blames doctors and the lawyers, right? And it goes round and round and round. But the real problem is it's no one's fault. The better we get, the more dollars per patient. And these are the kind of things, no one's going to get elected talking about this. No politician would touch this. And that's maybe why we need more things like this, where we can talk about what the real problem is and what are we going to do about it. And we've got religious scholars and people who can think about the problem from an ethical and moral point of view and not just dollars and cents, because these are big issues. And we're not going to, we're going to have to make some pretty important decisions. Some very big ethical questions have to be resolved. You know, we're in farm country, right? I mean, we could say that, right? That's fair. I don't know any farmer who lets a horse down his farm who can't pull the plow anymore. You know what I mean? It's harsh. It's a problem.